Hello, I'm Dr. Sundaresan, a dermatologist at UTMB, and I'm here to talk to you about isotretinoin, also known as Accutane. This medication is taken as a pill for several months when other prescription treatments such as topical creams, oral antibiotics, or birth control are not working, or when your acne is severe. Isotretinoin is a vitamin A derivative and works by decreasing inflammation and reducing the oil production in the skin, leading to less clogged pores and clearer skin. If you choose to do isotretinoin, you should not use any other acne prescription medications besides some form of birth control. A typical course of isotretinoin involves monthly in-office appointments for an average of 6 to 7 months, though longer courses are often necessary, and consists of taking 1 to 2 pills per day. Exact dosing is based on your weight. You may experience your acne worsen for the first few weeks to months, but rest assured this is to be expected and your acne will then begin to improve. If you are directed to take 2 pills a day, both pills can be taken together and your medication should be taken after a fatty meal, such as avocados or peanut butter, to increase your body's absorption of the medication. A common side effect of isotretinoin you should expect to experience is dryness, including dryness of the lips, which will make Vaseline or chapstick a necessity. You may also have dryness of the nose, which causes nosebleeds, in which case Vaseline application or humidifiers can be used, and dryness of the eyes, which can make wearing contacts difficult and may require lubricating eye drops. Some people experience muscle aches and joint pain. This is usually intermittent and well tolerated, but if it becomes more painful or persistent, let your dermatologist know. Infrequently, isotretinoin can cause liver inflammation, resulting in elevated liver enzyme numbers or triglyceride values. This is why it is important to check your baseline values through a blood draw and then recheck these values for the first few months of treatment. Most patients' liver enzymes and triglycerides stay within normal limits, and they can safely continue isotretinoin. If your numbers elevate, which happens infrequently, your dermatologist will discuss strategies to lower these numbers so you can try to finish your Accutane course. If your numbers elevate, which happens infrequently, your dermatologist will discuss strategies to lower these numbers so you can try to finish your isotretinoin course. Now, this next part cannot be stressed enough. Isotretinoin is not to be taken by pregnant patients, as the medication is a teratogen, which means it causes very severe birth defects in developing fetuses. This can result in self-aborted pregnancies and be dangerous to the health of the pregnant mother. Pregnancy needs to be avoided at all costs. Thus, all patients with childbearing potential must use 2 forms of birth control, most commonly but not limited to oral contraceptive pills and male condoms. But there must be 2 forms of birth control used throughout the course to prevent pregnancy. Male patients should avoid sharing the medication with others. Patients should not donate blood during the course to avoid a pregnant patient from unknowingly receiving that blood. Patients with childbearing potential will have to have an in-office monthly negative pregnancy test to receive the next month's supply of medication. Isotretinoin is prescribed through a government-created system called iPledge to prevent pregnancies, and only 1 month's supply of the medication is given at each visit, necessitating monthly visits for the whole course. Now, there are some side effects that may seem worrisome that we should watch for, but these are extremely rare. The medication can rarely cause persistent headaches that don't respond to Tylenol or ibuprofen, and sometimes with accompanying nausea, vomiting, and blurry vision. If this happens, stop the medication and let your dermatologist know right away. There are also reports in the medical literature of isotretinoin causing people to become sad, depressed, and have thoughts of hurting themselves or committing suicide. I will tell you that most people who are on isotretinoin actually become happier because their acne improves and they become more self-confident and have more self-esteem. But you and your family and your friends will have to monitor for signs of depression or suicidal thoughts, in which case you need to stop the medication and again alert your dermatologist. Finally, there are some reports of isotretinoin being associated with a disease called IBD, inflammatory bowel disease, a disease where people can develop ulcers in their GI tract. The medication does not cause this disease. It seems more that people who have a lot of acne, inflammation in their skin, are predisposed to having inflammation in other places, such as their GI tract, regardless of whether they are on isotretinoin or not. The medication does not cause this disease. It seems more that people who have a lot of acne or inflammation in their skin are predisposed to having inflammation in other places, such as their GI tract, regardless of whether they are on isotretinoin or not. But what's important is that you self-monitor for any persistent abdominal pain, diarrhea, and bloody stools, and let your dermatologist know if this occurs. To summarize, isotretinoin is an oral medication used to treat severe or treatment-resistant acne that is taken for several months. While it is shown to be very effective, it's important to avoid pregnancy and adhere to routine lab monitoring to avoid elevated triglycerides and liver enzymes, and to be wary of side effects such as persistent headaches, blood in the stool, and psychiatric symptoms. We hope this gave an informative overview of isotretinoin and what you should expect from your treatment. Thanks for watching.